This is one of my most common questions for the week, not just from my work in the ER, but also family and friends and social media. Today, we're talking about how to manage diaper rash. Almost every parent has been there. It is stressful for you and it's uncomfortable for the baby. But here's the good news. Most diaper rashes are common, treatable, and also preventable. Hi friends, I'm Dr. Nkirk. I'm a Pediatric ER doctor and mom, and today we're breaking down every single thing you know about diaper rash, why it happens, how to treat it, when to worry, and how to keep it from coming back. Diaper rash is simply an irritation of the skin in the diaper area. It can look like redness or darkness depending on the color of your child's skin, have tiny bumps, or even have some raw spaces and places depending on the cause. It is common between the ages of about 3 months to 12 months, but honestly, it can happen at any age while a child is in diapers. The diaper area is warm and moist and is exposed to irritants like urine and stool and even some wipes. It's a perfect location and perfect storm for irritation and a diaper rash. Okay, now let's break down why your baby might be getting a diaper rash. Sitting in a wet, dirty diaper for too long, which sometimes is totally normal and unavoidable, especially overnight. Friction when diapers rub against sensitive skin, especially around the buttock area for some babies. New product, especially for babies that have a sensitive skin, wipes, soaps, even laundry detergent can actually trigger a diaper rash. Yeast infection. This one is actually very common, especially in younger babies and after antibiotics. The rash from yeast is actually very distinct. It is very bright or beefy red and have some dots around the edges. It can also be caused by bacteria, though those rashes are less common, but they look angry, have some yellow crusts around it, and can have pus coming from it. Just a quick story of all the families that I saw this week in the ER and also family friends, about 7 of them, 5 of them had the rash from like being wet and moist, and 2 of them were from yeast, no bacterial infection. Now, this is the part every parent wants to know. How do you make a diaper rash go away? You need patience, persistence, and these 3 steps. Number 1, keep the area clean and dry. I know you've probably heard this before, but remember I mentioned the diaper area is a perfect storm for irritation because it's moist and wet. So the first step is to keep it dry. Change diapers very frequently, even if it's just mildly wet. You want nothing wet in the diaper area. It is best to clean the area with just water and a washcloth. If you choose to use wipes, make sure you're choosing water wipes. Some babies and kids are sensitive to different types of wipes. When you're done cleaning, you want to pat the area dry and leave it to dry. You want to avoid scrubbing the area because the irritation and the friction can actually make the diaper rash worse. Number 2, apply a thick layer of a cream on top of the buttock area. Think about it like you're putting icing on a cake. The trick is to put it as a layer and not rub it into the butt. You want it to protect the skin from any pee and poop that's going to come in contact with the diaper in between. So apply a thick layer and leave it heavy and layered on the buttock before you put the diaper. Now, the other common question is, what product do I actually use? Here's how I like to look at it and how I gradually escalate and go to the next step of what product I will use. If your child has no diaper rash, with each diaper change, use a petroleum jelly like Vaseline or Aquaphor to make sure there's something there and protecting them when they have no diaper rash. If you start noticing a diaper rash, I usually recommend switching to something that has zinc oxide. There are different percentages. I start going up from like 10, 15, and there's actually 40% you can use, especially if the rash is progressing. Triple paste contains about 12% zinc oxide. Butt paste contains about 16-17%. There's Zestine that also contains about 40%. So it's about graduating, but also talking with your provider to know which one works for your baby at a certain period of time. A combination mix with Maalox and Aquaphor or Mylanta and Aquaphor is a hidden gem that a lot of people are not aware about, but it works like magic. I use it a lot for my patients that have had a lot of diarrhea and are having diaper rash and irritation from the diarrhea. The reason it works so well is because the Maalox or Mylanta in the mix absorbs all the irritating acid, and then the Aquaphor protects the skin. So that combination helps heal the area and it works like a champ. Now we talked about the products. The next step is having diaper-free time. I know this is probably a difficult step, but you want to let the bottom breathe because fresh air actually helps the skin heal better. Let your baby go without a diaper when possible. Air is your friend. Lay a towel down on the bed and put them down and let them play while the air cools and makes the area also dry. Another trick you can use to let them get some air without leaving them out without a diaper for a long time is to use a dryer on cool settings. And I actually love that. You can put on cool settings, position the dryer a good enough distance from your baby, and just help dry that area. It brings the air, dries the air. It actually makes them feel good sometimes. Now, what if you tried all the 3 steps, the keeping it dry, the product, and the diaper-free time, and it's still not working? There are 2 possibilities, or maybe 3. 1, it might be a yeast infection. Yeast thrives in moist areas, so it becomes beefy red and angry, and also at the corners and edges. And you probably need an antifungal cream like nystatin, which your doctor will need to provide. 2, it might be a bacterial infection and might need a prescription antibacterial lotion or cream or product, so you probably need to see your doctor for that. And finally, it is possible maybe a sign of another systemic or something else going on inside the body, especially if that rash has been lingering on for about months or even longer than that. So I highly recommend, if you're doing all the things I listed religiously for about 1 to 2 weeks or even less and nothing is bulging, you probably want to get someone to see it, your doctor or another health professional, to give you some more guidance on that. Now, the best strategy to prevent a diaper rash is to avoid it in the first place. And here's how you can avoid a diaper rash in your baby. Change diapers often, especially after poops. Don't wait too long to change the diaper. Use fragrance-free wipes, mostly water wipes, or even washcloth to wipe their diaper area every time you change them. Apply a layer of barrier cream every time you change the diaper, things like Vaseline, alcohol like we talked about, especially at night when you're going to be changing them less frequently. If your baby or your child is on antibiotics, you want to be extra careful. Yeast loves their environment, so you watch the diaper area and be proactive. Probably want to do more frequent diaper changes and also barrier cream during that time. Make sure the diapers fit well, not too loose, not too tight, otherwise it may cause rubbing and friction, which can also be an irritation that will trigger a diaper rash. Now, when do you start calling a doctor or seeking for help? Most rashes in babies and kids are going to resolve within a few days. But call your doctor if your rash is not improving within 3 to 4 days, especially if you're religiously doing all the things you need to be doing for the rash. You see pus, oozing, or any yellow crust around the diaper rash region. Your baby has a rash with a fever or any other concerning symptoms to you, or you're just not sure what it is, it's always okay to still check in and get an opinion to make sure your baby is getting the best treatment that they deserve. So let's wrap up. Diaper rash is very common. Moisture and friction are the most common causes. For treatment, remember, clean, dry, barrier cream and air time are the best tools to help manage it. If you found this video helpful, let me know in the comments. I love hearing from you, questions or comments, and share this with another parent. You may save them a stressful diaper rash moment.